I feel like I was brushed off a lot. 'Cause it's just like, it was like, how many more ultrasounds can I go to do to see that there's nothing there? Like I'm still experiencing the pain. You're saying you're not seeing anything. So then it's like, why are you not helping? Like to go further. Yeah. So I didn't feel heard.
Welcome to Freedom to Know Wellness, where voices are heard.
Please advise, the information provided in this episode is from the opinions of the interviewee and interviewer. For further medical advice, please contact your practitioner. This episode includes images of pelvic floor therapy devices and discussions about female reproductive health that may not be appropriate for younger viewers. Viewers' discretion is advised. Now, let's start the interview. Welcome to Freedom to Know Wellness, a disability platform that holds space and gives a voice to those with disabilities due to chronic pain and complex medical conditions, and to those suffering from female reproductive disorders. In this episode, I will be discussing a reproductive disorder that is common, but not always talked about, which is pelvic floor pain or pelvic pain. It's a condition that makes sexual intercourse very painful, not only acutely during sex, but always afterwards, leaving women in chronic pain. Let me correct myself, not always, but often afterwards. Modalities such as pelvic floor physiotherapy are the main treatment plans provided for temporary relief to even complete healing from this condition. But it is still an uphill, arduous journey that requires, at times, additional treatment modalities than just the pelvic floor physiotherapy sessions alone. Today, I'm speaking with one woman's current journey with pelvic pain and the trials she has faced in her healing through attaining treatments. I would like to welcome to the Freedom to Know Wellness podcast, Aisha Nicholson. How are you doing today, Aisha?
I'm doing well today. I hope you're doing well as well.
Yes, I am. Thank you. Thank you. So, Aisha, tell the Freedom to Know Wellness listeners a little bit about yourself.
Well, hi again. I'm a performing artist. I'm also a Reiki practitioner, and I'm also the creator of the Movement Check-In as well.
And what is Movement Check-In about?
The Movement Check-In is a platform on IG Live where we bring together artists from the city of Toronto and also from outside the city in different countries. And we just connect with them and just check in to see how they're doing, especially during the pandemic times, where things were kind of uncertain. So, it's a time to just check in, see how your body's doing, how they're doing mentally, physically, all the other above.
So being a professional dancer, you find that movement is very healing, it helps to release. So you're taking that same concept of dance and giving it a way to be able to help people with mental health. Is that what I'm understanding?
Yes, correct.
Wonderful. Yeah. Because honestly, sometimes you have that pent up energy and the frustration, and movement helps to get it out. Even just, I'm like, releasing stress.
Yes. I totally agree. 100%.
Okay. And so you mentioned that you're also a Reiki practitioner. And how long have you been practicing for?
I've been practicing for since 2022. So I think this year will be about a year and some change. So yeah, I've been doing it for a while. But I feel like I've always been like a spiritual person. So this is just like an added layer that's added on top.
Okay. So it's something that you found that you were drawn to no matter what.
Yes. 100%.
All right. So when did you first start experiencing symptoms of pelvic floor pain?
Then I can recall probably around like in high school. So that'd be let's say 2015 or so. I could say from there.
And did you find that it related to your cycles?
Possibly. Yes, I do believe so. It could possibly do that. Yeah.
Okay. And did you start seeking treatments from your practitioners at that time, or was it something you were just living with?
It was something I was just living with. I think I just didn't know what it was. I thought it was just period pain. I was like, oh, maybe it's just pain because I have extreme period pains. So I kind of just associated with that. So I didn't really seek any treatment at that time.
Okay. And did the pelvic pain then
and over through time worsen?
Mm. Yes, I definitely agree. It did worsen over time. And I think also in between getting more active sexually, it did increase pain as well.
Okay. And how do you find the pain affects you, affects your life? Does it affect you on a daily level? How does it affect your life?
Yes, on a daily level at times. Sometimes it would be like sporadic moments where the pain would occur. And then other moments would be like sexually as well. But yeah, it definitely did affect my life periodically.
And out of curiosity, like when you're doing dancing or any type of athletics, did you find it affects you then as well?
Yeah, sometimes, yes.
So what remedies did you use?
At the time, so I think it's like on the latter end of understanding, like going through the process of the medical process and then later finding out the process that I used, where I did like at the time Reiki on myself. I also had exercises that so I pelvic physiotherapist as well, and like breathing exercises, stretches. But that was like on the latter end. But before there wasn't really any things that I did at the time because I wasn't sure what was going on. So yeah, that's kind of it.
So what led you to the understanding that you have pelvic floor pain, or that's the diagnosis that led you to doing Reiki and seeing a pelvic floor physiotherapist? What was that journey?
Wow, that journey. It was a long one. I think it was just like one day it became too severe, like very debilitating, whereas like I couldn't really necessarily get out of bed. And it was like I had to force myself to either like go to dance class and be like, okay, you're gonna still have to perform or, rehearse with this pain. Um, so yeah, I think I just checked into the doctor with my regular GP to figure out what was going on. Um, and it kind of just led through a series of, getting ultrasounds. And then first it was like, okay, do you have fibroids? No. Okay, do you have ovaries on your cyst? Cyst on your ovaries? No. So it was just like a constant, like, okay, what is going on? I'm clearly experiencing pain, but there's no answer. So it was like that process. And then, of course, waiting for a bit to get referred to a gynecologist. So then it's like, okay, you go there. Then I think I spoke to them over the phone. It was like a phone, what do you call that? I don't know, not an interview. Say it again?
Like an assessment?
Yeah, an assessment. Yeah. So it was like over the phone assessment. And then they referred me to a physiotherapist where I guess they had thought it was a pelvic physiotherapist. Yeah, they thought it was they did. So when I went, the lady did not specialize in pelvic physiotherapy. And I was like, oh, okay, interesting. This is what I'm here for. But it was just the basics of like, okay, we're going to do these type of stretch, does this hurt? Does that hurt? And I'm like, these are all exercises that I do during dance. So it's not really in a sense helping me. Like I understand it, but this is not kind of what I'm here for. So now I'm referred to you and I'm here doing a couple weeks session and it's not necessarily helping me. So after that process, I went back to my GP and I was like, it didn't help. Like I need to know what's going on. I'm still experiencing pain. I need to understand what's happening with me. And then later on, because it's always a process, you would have to wait. It's a couple months and you have to wait until you get referred or you wait until they call you back. And then finally, the gynecologist referred me to a pelvic physiotherapist, which I was just like, finally, like, thank you. This is what I'm needing this whole time. So yeah, finally I went to the pelvic physiotherapy and it was just like light bulb, like, this is what's happening. There's painful pain that's happening there. And there's discomfort. So when I went there, it's called Advanced Pelvic Physiotherapy, I believe. It's down on, I think it's on, I know it's downtown Toronto. I forgot what street it's on. But yeah, I went there and the doctors they really helped me to kind of understand what the pain is, what it's called. I finally got like a diagnosis of what it's called. And like exercises to assist me to relieve the pain. as well. So that's kind of like the journey to getting the diagnosis and understanding what is actually going on.
So I did look up Advanced Pelvic Physiotherapy Center.
Mm.
That's what I saw. That it was the name of the company. But when you went, you said that they provided exercises for you to do. Did they also do any type of internal physiotherapy work on you?
Yes.
Okay.
Yes.
And
External as well.
all right, wonderful, wonderful. And so I know for some women, they are prescribed. There's a device called I want to call it the magic wand, but
Violator.
I know, yeah, or the magic wand or something another. I called it the magic wand. I think I'm saying it wrong, but it's something that helps. The same thing that they do internally that you can go at home and work on those areas. Did they prescribe something like that for you as well?
Yes.
Okay.
Yes, those are exercises that I got as well.
And so how much the pain was prior to once you saw and you attended Advanced Pelvic Physiotherapy Center and doing all these different exercises, what was the pain difference? What was the shift?
When they ask you this, like, what pain are you at now? I think I was at probably a 9 at like a beginning when I got there. And then in the later end of going, like doing the exercises and going to the appointments, I think I was at like a 4.
Wow.
Yeah, it was significant. Like I was seeing them red with, yeah, like I was very, like I can't think of the word at the moment, it's not coming to me. But I did attend my appointments. I did my exercise because I wanted to feel less pain. I did not want to continue. It's been for so long. So I was like, I don't want to continue feeling this pain going forward as well.
Wow. Wow. That's a significant amount because the way you were speaking and being a dancer myself, we live with pain. We know what push through pain. So when that is hitting you that's compounding on top of the physical pain that you do as a dancer, it's a lot to manage. So to have that significant drop, say even from a 10, because the way you sounded, that was like a 10 that you were experiencing. But as you mentioned, when you got there, it's about a 9 down to a 4. It's still pain, but it's more manageable at this present time. Wow. Wow. So when did you combine Reiki with this? Like when did you start knowing about Reiki that you can be able to do self-treatments?
Yeah, I think when I went through my Reiki certification is when I understood like, okay, I can do Reiki. I think the first level is in terms of like you learning to do Reiki on yourself. So it's about like 2022 around there. My therapist did it on me and I was like, oh, this is such a healing experience. Like I want to experience this as well. So I went through the process to get certified. And then, it's just like you could do spot treatments or, do the whole body as well. So it's kind of like, that's kind of where it started. And then I was just like, let me see if this works. And then I just kept trying it. And I was like, oh, it's releasing, the pain as well. And also with like breathing exercises as well.
Okay. Okay. So are you still attending Advanced Pelvic Physiotherapy Center?
No. So I'm not attending anymore. I think this was like last year when it was my last session. They're saying like, you have progressed a lot. I think they're saying the only other thing they can do for me is like refer me to a gynecologist to go if there's any other further issues, than going forward. So yeah, that's kind of it. But I'm still waiting for a referral to the gynecologist. It's been about maybe almost 6 months. Yeah, I went back to my doctor because they gave me a referral sheet that had like explained like the whole process, of everything that I'd gone through and like diagnosis and stuff like that. And my doctor was like, okay, well, I'll refer you. And I'm like, oh, okay, that's it. Like I was very adamant. I was like, okay, I need to see a gynecologist. I need to see, the next steps going forward, to what can be done. But yeah, I know I'm still waiting to hear back. I think it's about maybe 6 months or a little bit less. I've been waiting now. So now it's like, I guess I have to now further advocate for myself and call them back to see what's going on. Because I think for me, it felt like, it was like, oh, okay, well, yeah, very lackluster of, we'll get back to you, or I guess you'll have to wait. So that's kind of where I'm at now.
It is a process to have to wait so long to see a gynecologist, especially when you're dealing with chronic pain. And this, as much as we think, oh, well, it's just female reproductive disorders, what have you. But that type of chronic pain affects your work life. As mentioned, your intimacy with your partner. And I'm just going to backtrack to before you saw the Advanced Physiotherapy Center. How did you find that type of chronic pain impacting your mental health? And you're also dealing with these practitioners prior to finding the Advanced Center, Advanced Physiotherapy Pelvic Center. How was that affecting your mental health in regards to getting some type of help and treatment?
Wow. Yeah, I think just negatively, because it was the feeling of I guess anxiousness. Because it's I know the pain is there, and then there's times when it would just happen sporadically. So it's oh, okay, now how do I deal with this pain? It's it was just a psychological mind warfare in my brain. Yeah, and I think there was also hard times where it was what is going on? I'm sad. I just want to figure out what the issue is. I don't want to continue, this and not knowing. The unknown, sometimes it can be great, but it was a very scary kind of moment to be I don't know what's happening. Yeah. So it was a whirlwind. It was a lot. It was a lot.
Some people, it's funny because doctors will say, oh, it's better that it's nothing, it's not this, it's not that, which we understand that we're grateful that it's not, cancer or something like that. But at the same time, having a diagnosis gives you a sound mind. Okay, you know what's going on. Okay, you know how to treat it. Not sitting there living with the thing and thinking, well, if no one can help me, just it makes you feel lost.
100%. Yes, I agree.
And with your practitioners, when you were seeking their help and counsel before you went to the pelvic floor physiotherapist, did you feel heard, or did you feel like you were brushed off for a while?
I feel like I was brushed off a lot. It was just it was how many more ultrasounds can I go to do to see that there's nothing there? I'm still experiencing the pain. You're saying you're not seeing anything. So then it's why are you not helping? To go further. Yeah. So I didn't feel heard 100% at times.
Okay. Is this they were just throwing the basic Band-Aid of just go take an ultrasound and that's it? And even so, it was just backtracking. It was your GP that referred you to the pelvic floor physiotherapist, or was it a gynecologist? And sorry, I'm not remembering now, so forgive me for having to backtrack. But you mentioned that you were sent to the gynecologist by your GP. Well, why isn't that that same gynecologist you're able to see? So you're on a 6 months waiting list just to see that gynecologist?
Yeah, I never saw them. I only spoke to them on the phone. Yeah, because that's what I'm telling you. I thought in my head, I guess just how I thought it was going to go. I thought in terms of my referral, I thought I was going to get a call of an appointment to see the gynecologist and then go from there. But it wasn't like that. She called me and that was it. It was a phone call. And then it was okay, we'll send you the information. We're going to refer you to this place. And I don't know what this person looks like. I don't know where they practice. I've never been there. It's only a phone call is what I got.
Interesting. And so now there's a 6 month waiting list to see that person, or more than 6 months. Yeah. It is a while. I'm on a waiting list to see someone, and I have a funny feeling that waiting list may have gotten messed up. In a couple of years now, and I'm thinking, I think I need to call back and see if I'm on the waiting list or if I just got thrown by the wayside. And I know technical errors can happen, but if you haven't already, please follow up with them and let them know I still need the help, because you're still dealing with the pain. But thank God that you're able to get some type of ease and relief.
Yes.
And so with your Reiki treatments, like you mentioned about womb healing through Reiki, energy healing. Can you just give us a small example of what you do to be able to help ease your pelvic pain?
Yeah, so usually like in terms of the practice, like I'll do the Reiki and then I'll usually like hold it down on like my pelvic area or the specific areas I don't really can't fully see, but in the specific areas that's painful. And I'll just like hold it there. I will breathe through it and I'll stay there for about, could say about maybe 15 or 20 minutes. I think it just depends. Some people could do it for 5 minutes or so, but it's just like I'll just sit there for about 10, 15, 20 minutes and I just breathe, relax. And also sometimes I'll have like, healing either type of music in the background as well. And then I just kind of sit there until I feel like the pain slowly just like, it feels like melting away or subsiding. Yeah, as well.
Right. With, I'm just thinking back, usually it's funny. Usually when you have an ultrasound, if they cannot see anything, then they won't refer you to a sonohystogram, for example. But yes, I really hope that you're able to see the gynecologist and just to be able to, just to make sure that there's nothing else going on and that they can continue monitoring you along with a pelvic floor physiotherapist. But I'm really, really happy that you've attained some type of relief. Along with the Advanced Pelvic Physiotherapy Center here in Toronto, were there any other followers that you on social media or practitioners that you saw on blogs that you have sought counsel from or just, watched and practiced their treatments?
Well, not necessarily like I saw, like I would watch a couple of YouTube videos, but not like the one in particular. But I think it's just like the process of like going to the advanced pelvic physiotherapist clinic and then just doing Reiki. I think that was kind of the main goal for me at that time.
And where or who did you get your Reiki certification from?
I got it from, oh my God, it's called, oh my gosh, wow, brain is just went today. I think it's GTA Reiki Toronto, I believe. Yeah, and my practitioner, her name is, the Reiki Master, or my teacher. Her name's Lana Evanson.
Okay, so she's one of the instructors from there.
Yes.
Okay, so she's not like a private owned, she has that. Okay. All right. And are you seeking any type of, for your mental health, were you doing anything in regards to aiding your mental health through everything that you were going through? Like any therapist or your own practice?
Yeah, I think it's my own practice and also just like getting outside. I love nature. I love water. So there's that. Yes, I also had a therapist as well, which I was like so helpful during those times. But yeah, anything in terms of like nature, dancing, and stuff like that is kind of what I was doing to help with like my mental health. Like there's so many things, journaling, just writing, drawing, painting, tending to my plants, anything that kind of like brought me joy and happiness as well.
Right. And do you find that now that your mental health, that you can feel more calmer, more, when you feel that inner peace, do you find that has also affected your womb pain and how severe it was or is?
Yes. No, I definitely agree. I definitely agree with that because I do like while I was going through the process at the clinic, it was a lot of like my brain was like, oh no, the pain is gonna happen. So it's like my body would just tense up. So then now, like, yes, I do feel a lot calmer. My body's more relaxed. I am able to now allow my brain to ease and be like, okay, no, everything's gonna be okay. Like your body can relax. You can ease into this. So yeah, no, definitely 100%.
And what advice would you give our listeners who are dealing with pelvic floor pain?
Wow. The journey, it's a long journey. It can be short at times, but just continue to advocate for yourself. And if you can find any people that are around or any practitioners or doctors that can assist you and that are going to be there for you on this journey, stay with them and just continue on and be strong. Definitely.
Wonderful. So Aisha, you mentioned that they sent you for many ultrasounds. And I was saying that usually when they don't see anything, they're not going to refer you to do a sonohysterogram, which would give you a more in-depth view of the uterus. But another great option is an MRI. MRI is very good to be able to see like the outside and where the tumors are, if there's any type of fibroids. But that is something that maybe you may want to ask for to be able to see if there's anything else that's going on. Because it's nothing worse is that something else that is there and they're not aware of, and medicine hasn't advanced enough, as one of my practitioners had said. It's a still learning process when it comes to medicine and finding out conditions. So that may be something that you may want to try and see. But I am really wishing you the best of luck in your journey, because it's an ongoing journey for you. And I really hope that you attain full healing from this condition. But besides that, you have no other issues with like heavy bleeding and stuff like that throughout your cycles? No issues like that?
I used to. We used to have a heavy cycle, but I did get an IUD. So that kind of shifted things. So it's no longer in the terms of like a heavy flow.
Right.
But yeah, in terms of you talking about like the uterus as well, it kind of brought up like, I'm trying to think, because I know that I've been told that I have like a tilted uterus that's facing down as well. So I was like, would that also associate with the pain as well? Not a question for you, but in terms of just like a question for myself and kind of like to further investigate as well, because that could possibly be associated with it as well. So
that is true. Did your pelvic floor physiotherapist say anything pertaining, like they mentioned, I guess, that you have a tilted uterus and it's tilted downwards. Did they mention anything about that?
They did mention, and they're saying like to go further, to go see a gynecologist. They're like, get your doctor to refer you. So that's kind of like, that's what's the next steps.
Right, right. And does the pelvic floor physiotherapist give you like a report that you can be able to bring to your gynecologist when you're finally called in to go?
When? Yeah, no, I have the report. It's a long letter of information. I do have it. Yeah, and I did give it to my doctor as well. So yeah.
Okay, wonderful, wonderful. Well, definitely follow up with the physiotherapist and keep me posted. I would love the listeners to know about your journey and if there's been any improvements. And whatever things you learned also in your holistic practice to be able to help yourself. Now, as a practitioner, can any of our followers come and seek out treatment from you? Are you currently treating patients?
Yes, I am. So you can contact me by my email. It's Nicholson Aisha@gmail.com. So I'll spell it out. NICHOLSONAISHA@gmail.com. You can set up an appointment with me. I do have them during the day or in the evening. Whichever works best, you can email me and we can kind of go from there to set up a session. Usually sessions are about an hour, maybe 15 minutes for, a little discussion in terms of what we discovered during that time. So just contact me. We can discuss prices or days and hours.
Okay, wonderful. And also, do you have a website?
Oh, yes. No, not this time. I do have a link tree where you can like do the information. So I think it's linktree/number 4 HYA. So it's like Aya, but it's 4 HYA. That's the link tree.
Okay, so you can send that to me and I'll make sure to post that in the comments for the blog and for the podcast. Well, thank you again, Aisha, for being on the Freedom to Know Wellness. I really appreciate you sharing your story and your journey with us, because this is a journey for you. And definitely, again, keep us posted. And I'm wishing you wellness and the best of health.
Oh, sorry, I'm saying sorry to interrupt, but thank you so much for having me. And, that I could share my story and my journey with everybody on here and with you as well. Thank you.
Thank you. Thank you. So, as I always say, reading information is one thing, but hearing from a person's lived experience is another and paramount. And that's what we do here at Freedom to Know Wellness. Be well. The correct name of the pelvic floor therapy devices I mentioned are the crystal wand and the pelvic wand. This episode was filmed in January 2023. Aisha is now a Reiki Master and continues working as a Reiki practitioner and as a professional dancer. Aisha, to this day, is still waiting to see a gynecologist. I referred her to a gynecologist who specializes in Black and Brown women's reproductive health. Now, all women go through reproductive conditions, but certain conditions impact Black, Latin, and South Asian women differently compared to white or Asian women. Watch FTK Wellness's episode 2 of season 1 discussing this topic.
Thank you for listening to this episode. To have your voice heard on Freedom to Know Wellness, email us at info@freedomtoknowwellness.ca. For content like this and more, subscribe to the Freedom to Know Wellness blog at freedomtoknowwellness@substack.com. And for more podcasts, follow our FTK Wellness YouTube channel and find Freedom to Know Wellness on all major podcast platforms. And don't forget us on social media at FTK Wellness.